so much for coming. It's lovely to see you. Many familiar faces, many new faces. Great to have you. My name is Jitka Vseteckova, and I'm doing these Aging Well talks. What is it we would ideally know about aging, which is pertinent for all of us, because since the moment we're born, we are aging. These changes are just more pertinent as we grow older. And this talk today is the second talk in the series of 6 talks, and it's titled Aging Brain. We will be talking about what happens with our brains while aging. We will be mostly talking about physiological normal aging, so I will not be going too much into pathologies. I will mention briefly dementia, mild cognitive impairment, etc., but I will not be going in depth into that. These series are more focused on what is it we can do, how we can keep optimizing our mental and physical well-being that are very tightly interconnected. So I don't make a distinction between physical well-being and mental well-being in the series, because it's so closely interlinked that we just can't take one and talk about it in an isolated way. One influences the other and vice versa, and they're both absolutely crucial. So thank you so much for coming. This is just a recapitulation that we all know the world is rapidly aging, and physical and psychological cognitive decline happens at different speeds for different individuals. We've been talking a little bit about this last time already, mentioning also genetics, that genetic is not 100% of how our life is and is going to be going forward. But we were also talking about what weight, what importance epigenetics, the influence of the environment has. So it is not just about what we were given in the genetic set by our predecessors, by our parents in the hereditary pool, but it's also what we do about it and how we take care of what is working well. So this is what these series are mainly about. It is about not so much looking into what else is it we don't have, but how can we best use whatever it is we've got. These talks are structured around the 5 pillars, which are nutrition, hydration, physical, social, and cognitive stimulation. You will hear me mentioning them a lot. I'll be bringing your attention back to those, because these are 5 relatively little things we can do for ourselves, which is another thing that's very particular about these talks, which is what can we do ourselves. So how do we watch ourselves drinking? How do we hydrate? Do we want to hydrate more? Should we? What are the consequences if we're not? Why do we need to eat well and regularly and be mindful about how important some supplements are and some other supplements are not? What is it we need to know about physical activity, physical stimulation? What is it we need to know about cognitive stimulation and social stimulation? Why are these so important, and how it might be harmful for us not to do a little bit of the 5 a day every day? So this is the 5 a day a bit differently. One of the main motto that goes with aging that I'm sure we're all familiar with, because it's out there everywhere. It's use it or lose it. And today it will be particularly about the aging brain. How do we keep our brain working as well as it can, despite of the dreaded aging or age-related changes that just happen physiologically and naturally and are just part of the life we have. When you see this sign, it will be a little reminder that there is a bit of a stretching to do, so that we're not seated, or that you're not seated, because I'm standing, so that you're not seated for an hour and a half, I hope, today. Last time it was an hour and 50 minutes. We will do gentle stretches. So when this sign comes up, that's what it is. Last time we were talking about more in general about basic biomedical and psychosocial aspects of aging. Hello, no worries. Age-related conditions, bone health, frailty. Today we're going to talk more about aging brain, basic facts on neurodegenerative conditions that are associated with aging, and age-related and non-age-related memory loss. The next talk in January is going to cover nutritional needs of aging. Then talk in February will cover pharmacotherapy while aging, what happens when we take medication. This links a lot to hydration and to our kidney and liver function, that our kidneys and liver work much better when we hydrate well, when we drink enough. When we don't drink enough, there is always a risk that some of the medication we take stays in our body for longer and may interact with the next medication we may or may need to take. So we will talk more in depth about what happens with the drugs while we're aging, how the organism takes it, how it distributes it, and how long it takes to actually effectively clear out so that we're safe to take something else. And this goes for the medications we're taking regularly as well as the over-the-counter or non-prescription medication. Talk in March will be about Move It and Breathe. So it will be a more detailed journey into age-related changes in muscles, tendons, bones. I've mentioned osteoporosis in the last talk that is available now for you online. I'll point you towards the link where you can access it easily. And here we will be talking more in depth about muscle atrophy, how quickly we're losing muscle strength and muscle volume, and how important the muscles are, because they are not only providing an efficient padding around the bones, so the better health of the muscle, the better likelihood of the health of the bone, but also because there are capillaries in the muscles, it is easier for the bone to get good nutrition. If the muscle is not exercised, there are fewer capillaries, so the nutrition doesn't get to the bone so easily. So it has physiological as well as just physical effect. So it's quite nicely linked. And we're also going to be talking about breathing. I'm going to be mentioning breathing throughout the series and throughout our stretching sessions because it is a very important part of our lives. Basically, if we don't breathe, we don't live. So whatever breathes lives. So therefore we need to focus, or we need to be mindful about how our breathing is, because our brain needs oxygen in regular supplies. So whenever usually we're stressed, we find ourselves holding our breath like a goldfish, which is not the best thing to do. And now we may not always avoid it, but knowing that this is likely to happen can help us to realize that, stop breathing, need to start breathing again, because the regularity in the breathing means that regular supply of oxygen is going to our brain and other tissues, which is absolutely crucial. We will also be talking about exercising well and exercising enough. So I'll be mentioning things as we go throughout the series, so probably when we get to this point, it will be more of a recapitulation with some new information. The last talk for this year, or for this academic year, is called Standing Tall. And it is going to put together the previous talks and stretches we're going to be doing into our own feeling about how it feels to stand tall. What do we need to do to stand tall? And how the postural alignment, our posture, how it changes, not only with aging, but also with gravity, and what is it we can do to work against the gravity, which is not really our friend in terms of posture, because when our posture changes, it takes some muscle groups out of action that normally should be involved in, for example, maintenance of an upright stance. We'll get back to this practically today, very soon. So this is the plan of the talks. All the way through, we talk about, explore how using this knowledge might facilitate aging for us, for all of us, and how important it is for ourselves to become partners in our own care, because it's so important that it cannot really be outsourced to anybody else, and there is nobody else who will know you and how you feel better than yourselves. This is also a reason why we need to sometimes ask questions when we go to the GP and get a medication for some, let's say, bronchitis or another condition or illness. We need to know what is this medication going to do with the medication we're already taking. So there are many things we can do as our own carers, and through these talks, hopefully we would explore how best to go about that to be our own best friends. The emphasis of the Aging Well series in general is on optimizing cognitive and physical well-being. And as I've mentioned already, to a lesser extent, it's going to focus on pathological processes. So we're most focusing on normal physiological aging, although we every now and then touch the pathologies. And sometimes, as we will discuss today later on, it's difficult to see where the normal aging continues and pathology starts when we mention dementia, mild cognitive impairments, etc. All the way throughout the series, I will be very, very promoting physical activity, social activity, networking, engaging, learning new things, and making healthy lifestyle choices. And this is something that is, we think making lifestyle choices sounds like a luxurious thing to do that we can do because we're not up against famine, we're not up against wars, we're not just basically focusing on our survival. So lifestyle choices come to this as a luxurious add-on, but it is a very important add-on. Our lifestyle choices will play a huge role in how we age and how we live all those years that we're going to live longer, because we are. So it will impact on how those longer years actually are for us. As I said, there will be 2 stretching sessions, gentle stretching sessions in each talk, and at the end, please leave with me the evaluation forms, the feedback. I'm really interested to hear how you like the talks, whether there is something I could talk a little bit more about that wasn't included today. Last time I had a very useful feedback. Somebody mentioned to me that diabetes is very important. So I'm going to cover a little bit more about diabetes than I initially intended in the next talk. That's going to be around nutrition because it's very closely relating. So with a view of the next talks, if there is something you would like to hear more about, tell me on the form. Leave me email address if you want me to get back to you and send you some materials. Otherwise, at the end of the PowerPoint handouts, there are a few links. There is a yellow highlighted link for a Figshare, which is a library repository where the Aging Well series are now living. There is uploaded PowerPoint presentation from the first talk, and there I've already uploaded the presentation of today, and as we go, the presentations will be finding their way there. When we have the available video recordings, it will all be there, together with other links, flyers, and plans for the next year, because for next year, for the academic year 2021, I'm planning 11 talks, together with some of my other brilliant colleagues, so there is a lot to come. Lovely, so these are the already mentioned 5 pillars: nutrition, hydration, physical, social, and cognitive stimulation, and I'll be referring to them quite a lot. And now you see the lovely stretching sign. So if I can ask if you can just stand up, I'm gonna move over here. Yeah, you need to work a bit before I let you sit down. So if you can just make space around yourself so that you can just gently rotate, not really with hands apart, but just have a tiny bit of space around you. And while you're doing this, if you can start thinking and realizing how your feet are on the floor. If you're wearing heels or boots, feel free to kick them off and just put your feet as flat on the floor as you can. And now, as you're feeling your feet on the floor, try to press gently against the ground and just feel what it does in your body, what the response of your body is. Are you stretching? Are you lengthening? Are you raising up? Is your spine stretching? These are they're quite leading prompts. I admit, guilty as charged. If you can move a little bit forward on your toes, a little bit backwards, not too much, just a little. The range of the movement is not very important. It's more how you feel the body is responding. You will realize that your calves muscles are acting or engaging differently when you are on your toes. And there are different sets of muscles that are engaged in the maintenance of the upright stand when you are on your heels. Now, if you find some kind of a middle, your middle, because each one of us has the middle somewhere slightly differently. And now if you can do the same to the side and just go from one side to another very gently. And again, realizing how the sides of your calves get involved. So as you are finding your middle from the medial lateral perspective, try to press the inner side of your feet to the ground. Just push it in and let the little toes lift up a little. Now, as you're doing this, you may realize that the sides of your calves, the peroneal muscles, are really working hard. This is how your muscles should be feeling when you are standing, when you have to stand. It's how the muscles participate on the upright stand. Now, when you move now a little bit again, forwards and backwards, just very gently, try to realize where you are in the space. So I'm going to turn my side to you. So we might be standing like this with our shoulders forward. Now, if you think about moving your shoulders a little bit backwards, still you're pushing against the floor, you're raising up. And when you hit the moment where your abdominal muscles start getting engaged in your postural stance, this is ideally where your posture would be, where your standing posture would be. And you're still pressing against the floor. Now, don't forget to breathe, because we said breathing is very regular. There are many things. You can relax. We can sit down. We'll try the same while sitting as well, because we are up against the gravity, not only when we stand, but also when we sit. So as you are sitting, again, try to feel your feet on the floor and try to press with your feet fully on the floor against that floor. Now, this is, you may experience a bit of a movement backwards. So because you can't go completely back, you need to start creating a counter pressure. And you may, how do I say this? You do not press against the floor only, you press against the chair. So when you're standing, because your feet are the only contact you have with the ground, you press with your feet. When you're sitting, you press with your feet and with your bottoms. So when you don't press, this is how we are. When you press, this is where we get. So this is where we would ideally be. Don't forget to breathe as I'll be talking, and just try to find, again, your best posture. Think about 3 points. When we're standing, we have left foot, right foot, and the third point is somewhere over there. When we are sitting, 1 point is on the floor, the other point is on the chair that we're pushing against. The third point is here, so it's always a triangle, and you try to find your own balance. Now, because our bodies are slightly different, our tendons and joints are done slightly differently, we need to find this for ourselves. That's why no physiotherapist can tell you this is the right posture, because you are the only person who can feel the right posture. Physiotherapists, sports therapists like me, we can give advice or commentary how we may get there, but if you try to find it, you will. Sometimes it just takes a little bit of time. And now if you're still pressing against the floor, you would be feeling that your quadriceps, your muscles on your thighs, are working quite hard. And this is the way we exercise. This is already exercise. Actively maintaining an upright posture in the gravity field, which is where we live, is already an exercise. When we just give in to the gravity, it does not bring us much. So one of the things I usually say, not only around exercising, but in general around these Aging Well talks, is let's not take it too easy on ourselves. And I will get back to that, because sometimes I get questions around, tell me all that is exercise. Well, not avoiding stairs is an exercise. Going to shops by walk without a car, if we don't need to take the car or a bus, is an exercise. Making our lives a bit harder, not using all the advantages of the digital era. And we have lifts, we have cars, we have computers. But what happens is that our posture's changing. We spend way too much time behind our computers without compensating with running outside and just yelling in the parks, because it's good for us. And taking lifts instead of taking stairs just because it's closer, convenient. The first thing usually you see when you get into a building is a lift. So it's just not being too easy on ourselves and just not avoiding any activity, mentally or physically or cognitively, wherever we can. Now you can relax a bit before I get back to the next stretching one, but please don't forget to breathe. If you want to push against the floor, I'll check every now and then on you. No hard feelings if not. It's completely optional. If you have a chance, please drink. I apologize. Today we fell a little bit off the grid of our brilliant research office colleagues. So there is no water, there's just tea and coffee. There will be water next time. Water is very important. We'll get back to that. Right. So this is just summarize what our exercise in the gravity field would ideally be. So it would be about raising up principle, pushing away from the ground wherever we can, feeling the proprioception, feeling our feet on the floor, and realizing how it makes us feel physically. We will be moving head and arms next time. Right, so cognitive aging. There is, physiologically, with aging, there is some diminished ability to remember names, to find the correct words, to remember where objects are located, sometimes diminished ability to concentrate. The question that I usually get is this normal? It is. It is. It is. Last time, if you remember, and for those who are not here, you can find the talk on the site, download it, and read. We were talking about theories of aging. So there is a wear and tear theory. It's a wear and tear of our cognitive systems. It is absolutely normal to forget things every now and then. As I will mention later, it is brilliant when we still can remember what we forgot. The problem sometimes is when we cannot remember what we forgot. Is that connected with dementia? It will, yeah, I will mention dementia as well. Yeah, it is. I'm giving few links as well. There are testing kits. There are, of course, whenever in doubt, we need to speak to our GPs as soon as possible, because the sooner we catch it, the more there is today that can be done. It cannot be reversed, but a lot can be done to soften the impact and the progression. Exercise is one of the very often most mentioned things. So we talk about tiredness of our systems, and it's not just one system, it's many systems. As I've mentioned last time, each of the systems, cardiovascular system and musculoskeletal system and the brain system, central neural system, all systems are aging in their own way, which is treacherous. We don't know what system's going to age faster within one person. That's why it's nearly impossible to predict aging impact will have on populations, because it's just so very different for each one of us. So the only thing really we can do is to focus on what we still have. So use it or lose it. So train mentally, physically, cognitively, making ourselves to do things and learning new things, because this is very good for our brains. And I'll show you nice pictures of neurons that grow very nicely when we stimulate them, when we learn new things. And they diminish when we don't. And once neurons started diminishing and declining, they're on their way out. Neurons are an interesting thing. We have about 85,000 neurons that die every day in our brain. And if we're lucky, up to a certain age, up to 1,400 of neurons can be created and stimulated. So this is not a fair exchange, definitely, by no means. We're all declining, and I said last time that my father, when I was 20, kissed me, say, "Happy birthday, my darling. From now, you're going to be getting dumber and dumber because you're not creating any more neurons." It's not exactly true, but the amount of neurons that still can get created through the adulthood is incredibly, unfairly smaller than the amount of neurons we're losing every day. It's practically a neuron per second that just goes. Non-sleeping makes it worse, dehydration makes it worse, stress makes it worse, anxieties make it worse, depression makes it worse. I'll mention all that, goodies, but while we still have what we have, let's train it, let's work on it. Muscles are workable, our brains are workable, neurons can be stimulated, so let's stimulate them as much as we can every day. Ideal response is, therefore, the good lifestyle choices that can make these changes partially reversible, or at least not regressing so quickly. So it's only what we have, we have. We cannot change the genetic outset we were born with, but what we do with what we've got is a matter of our choices. So that's where we are. These are the neurons. So this is the normal, not very stimulated neuron with no stimulation. These dendrites decline as well, so it becomes even more bare. While stimulated neuron looks like this and even better. Stimulated neuron makes also connections with other neurons. So this is why the neuronal stimulation with learning anything new, and this is why it's not only about physical exercise, although physical exercise is a phenomenal way to stimulate neurons and for neurons to make interconnections, but it's also being sociable, engaging with people, with things we have around us, which is what you're doing because you're here. So let's keep doing that, because the stimulated neurons are much better, and this is what happens with the brain when the brain is aging. So with age, brain is naturally shrinking. It's happening to all of us. After some age, this might be happening faster, might be more pertinent, but it's happening to everyone. When the neurons are stimulated, the brain will not shrink that fast. So let's use what we have and let's work on it, because it just makes our life better. What else is normal for cognitive aging? So general slowing of neuronal and sensory processing and perception and increased spatial segmentation. This means that we are slower when we're responding or reacting. It may not be just in a conversation, but it will be physically as well. So the central neural system will work and will send the response or an action to Paris through the neuronal works, pathways, to the periphery, to our hands, to our legs. When we are tripping over obstacles and we're young and the neuronal system works very fast, uninhibited, without any problems, and it's not tired, there is no wear and tear, our responses are very quick. So the moment we want to lift the foot, we basically lift the foot and go over the obstacle. With aging, this is slowed down, and it's not just the response that is slowed down, but it's already the first information that comes from the periphery. So the first information is delayed, the response is delayed, which means there are several delays on the way before we are able to actually lift the foot and get over the obstacle. This is why tripping over obstacles is so easy as we grow old, because it's just the physiological response is slow, there's nothing much we can do with that. Exercising makes this a bit better. What I mean by exercising, as we exercised earlier on, walking, staying active, using our body for as much as we can, helps a lot, but it will not reverse the process, because the aging process is irreversible. In the end, everything will be worn and torn. Decreased complex, divided and sustained attention, and primary and working memory and retrieval of stored memory. This means that we may have shortened attention span and difficulty retrieving information. So it's, for example, if I give an example of a filing system, you know where you have your filing cabinet, you have labeled folders, and you store information in those folders. You know the pathway where you need to go to retrieve this information. This pathway may get impaired for one reason or another. It can be trauma, it can be an injury, it can be hospitalization with a lot of muscle atrophy, medication, general anesthesia is very bad as well. So it might be a combination of things. It may not be just one, tiredness of the system or wear and tear of the system. But sometimes the way to retrieve the information from the filing cabinet where we know it should be found might be temporarily lost or just unavailable. So we may be, to some extent, able to create a plastic way around it, because brain has an immense plasticity. This plasticity is not so huge while we're aging, but it's still plastic, and there is a chance to learn new pathways. So there is, up to a certain level, there is always a way to create an alternative way. But it cannot... Some of the damage sometimes may be irreparable, and that's when the system will either create an alternative route to where we want to get, or this route will disappear together with all the filed information. And this is sometimes also what may be happening with neurodegenerative diseases, which dementia is one of them. There is not just dementia, but what happens with the brain is that you see the cables, right? You have immense amount of cables. You just fold them. You just have them like that. And then you can imagine that there is some kind of acid dripping, and the acid drips through down. And depending where it started dripping and where it goes through, these areas are impaired. And this is what happens with neurodegenerative conditions, where dementia is just one of them, Alzheimer's is just one of them. There are many other ones. There are multiple sclerosis, there's Parkinson's, there are many other conditions where the brain gets impaired, and because we don't know what exact wire goes from here and there, we're clueless as per to say how is it going to demonstrate in our life. So this is very difficult because we can't see what's happening in the brain. We can see something and we know that this lobe is mostly responsible for that and that this part may be mostly responsible for that. But if the plasticity of the brain is still available, there can be an alternative route built if the plasticity is not available anymore because the wear and tear has reached a very, very high level and the reparatory mechanisms of the brain don't work anymore, then the decline speeds up immensely and very quickly. And because the brain is just the central computer, once it's switching off, it can be hardly switched on. So it is something, I will make a comparison to falls. Of course, it's completely a different area, but often people ask, can we prevent falls? And I usually say up to a certain level of physical decline, physiological decline, we can. But when the decline reaches a certain level, falls will become inevitable part. Then we need to start thinking about padding. Alan.
Does the brain, do we know in the brain why it is that I can remember things when I was 9 years old? I can't remember what I had for breakfast.
Yes, it has to do with the changes of the memory. So things that you have been living much longer with will be stored better unless this is particularly, in your case, the area where the brain gets attacked for some ways. So you've been living with it all your life while the newer things may be just blurred. And it also, it often when it comes to memory, it is also about attention. So is it a memory problem or is it an attention problem? Because you may just not remember the newer things because you are not paying so much attention to them. While your attention span was better, let's say 50 years ago, you would have remembered the memory better. Sometimes what we remember as well and how we learn is linking to our hippocampus and to emotions. So when there are emotions involved in your learning, you're much more likely to remember the thing much better because there is a feeling coming with it. It's not just a dry learning as from the book. So this is why engaging with things is such an important concept, because if you, instead of learning or doing something you don't engage with, don't waste your time there. Go and find something that you engage with because it's going to be much more stimulating, much more pleasant, and it's much likely to bring you back. And now the regularity of the mental training and physical training and exercise and stimulation, the regularity is important. It's not just do it once every now and then. It is about making it regular, like blood circulating regularly will be giving in regular intervals nutrients and oxygen to our brains and tissues and everything, and it will keep us well. The moment we stop exercising, we become very sedentary, predominantly sedentary. The regular blood circulation is not bringing the nutrients and oxygen so regularly anymore. And if we don't have nutrients and oxygen in our tissues, the tissues don't work amazingly well. Brain especially, but all other tissues as well. So it is about the regularity. It's about continuous engagement. So you don't want to do this? Don't. Do something else that will make you happy, that will bring emotions. And don't make it too easy for yourselves again, because once you get used to some activity, you will just get on autopilot and it's going to get done. Fine, it's better than not doing anything. But if you can think about bringing in something new and thinking about new things you want to learn, you always wanted to do, you never found time, new things are important because it stimulates the neurons even more. And engaging with people around you, learning something similar or learning something else and discussing how it is and how do you find this and making these connections, it just stimulates the neurons even furthermore, and it creates the interconnectivity that then delays the heavy brain shrinkage that happens in old age. Another thing that is normal for cognitive aging is attenuation of certain personality traits. Personality traits and chronic conditions may become, they often do, may become more prominent. So the way somebody made you feel or your life, it's not going to get better the way him and you are getting older. That's just how it is. But then on the other hand, sometimes I say, well, if you go out, if you don't want to see people because you think they will make you angry, or even if they make you angry, it's a stimulation. So let's not make it the only stimulation, but it is also a stimulation. So whatever works. Right. And are we winners by choice? This is relating to what we've been just talking about and to the 5 pillars, because this is where us, for ourselves, and you for yourselves can make the difference. It's in our choices about what we eat, how much we hydrate. Do we hydrate enough? Do we drink enough? Last time I mentioned, and I'll be saying it again, it is the strict minimum of hydration of clear liquids should be 1.5 liters every day. And it's the strict minimum, and it's just to cover our basic metabolic processes that happen in the body, all the functions. So ideal, this is around 6.5 cups of water a day. Ideally, you would be closer to 2 liters, maybe 2.5. Over 3 is perhaps not so needed, because then you would need to replenish electrolytes and minerals and salts, etc., unless you're exercising, sweating a lot, and you just need to hydrate. So this is what we need to be mindful of. But the 1.5 liters, the 6.5 cups, are a strictest minimum just for our body to work without having any major output. And the better the body is hydrated, so let's say somewhere between 2 liters to 2.5, and again, it will depend on our bodies, how they work. So you need to see for yourself whether your body works better at 2.2 liters or 2.5. It's just being mindful about what is the impact of what we do on our body, on our system. But yes, go ahead.
To other liquids,
Other liquids, coffee, tea, alcohol are dehydrating beverages. They do dehydrate. So it is, if you have around, but again, it's about proportionality. So if you have 2 cups of water a day and 1 cup of wine or 1 cup of coffee, this is not a good ratio. If you have 9 cups, 10 cups of water a day, and a cup of coffee and a cup of wine, it should be fine. But it's about the proportionality. It's about what is the majority of the intake. What is it you do? So definitely having more clear water than just coffee or tea. It is secretly dehydrating because we're putting liquids in, but it has a diuretic effect. So our body loses the liquids very quickly soon. Yeah, I am not a huge fan of syrups, squashes, Fantas, Cokes. It's all sugar that is not necessary for our organism. We can get sugar, the carbohydrates, through our food. So I would always prefer to have a slice of bread than having the sugar in the drink. Although I need to say that alcohol has a lot of sugar, carbohydrates. So this is something we may want to or may not want to be aware of. But the amount of carbohydrates we consume every day is important as well. As we grow older and the metabolism slows down with age, we might be more likely to what is called impaired glucose tolerance, which means that It is about how insulin from pancreas gets injected into the system. Now, if you think about the pancreas that creates the insulin, that sends the insulin to the system whenever there is glucose in the bloodstream because we have eaten or drank something that contains carbohydrates, glucose, sugar. Think about it as a battery. I think I've mentioned this example last time. You have a battery for life. Now, how quickly you use it depends on how you eat, how you drink. So every time you have a sugary drink, there is a bit of insulin getting into the system. When we eat junk food, when we eat something here, we eat something there, we don't have breaks between meals. When we eat here and snack there and do this and drink coffee with milk and sugar, and we're continuously inputting something into our stomachs, it gets into the bloodstream in form of glucose, because everything other than just clear water and like proteins don't have so much glucose that they carry around. But there is insulin injected into the system to help the body work with the glucose in the bloodstream. Now, if the insulin keeps getting injected all the time, in 50, 60 years, there's not going to be much left. So this is where the glucose tolerance starts getting worse. And this is where we start having a pre-diabetic stage, for example, type 2 diabetes. So I'm not saying that drinking a bit of squash in 1 or 2 cups of water that you drink throughout the day will make you diabetic. But I don't know about whether somebody in your family had diabetes. If there was diabetes in the family, it might be that you might be more likely, which means that avoiding any unnecessary carbohydrates in the diet might be actually a better way to do. But again, it is about the proportions. So 10 cups of water without squash, 1 cup of water with squash. But yeah. Go ahead.
Does it matter if you consume your water, like 2 liters? So instead of taking a cup, throughout the day, so you flush it, like in the morning you drink 1 liter, and then the rest of the day you probably don't have time to drink, and at night you take another 1 liter. Does that help or is that worse because you have like lots and none?
It is a very good question. It is better if you have to get the water in and you really didn't have the time and you get it in a liter in the morning and a liter in the evening, it will probably wake you up throughout the night fairly few times. The quality of sleep after that may not be amazing, but it's still better to get it in. However, it is not an ideal scenario. My advice probably would be drink when you're not thirsty, eat when you're not hungry, which means don't get your body to the stage of neediness, thirstiness, and horrible hunger that we're fainting and we just have our heads that are spinning, we're cold, because we're just hypoglycemic. So these shocks are not very good for the body, because the shocks elicit another response that is usually hormonal. And whenever there is a hormonal response in our body, it triggers another hormonal response, that triggers another hormonal response, that triggers another hormonal response. And the whole circle of chaining of hormonal responses is just impossible to calm down sometimes. So if we can avoid the state of being very thirsty / moderately dehydrated, your lips shouldn't be dry. So drink when you're not thirsty. It's definitely much better to drink regularly in regular intervals throughout the day. What I do, for example, with my 4-year-old is I let him play. Whenever I go around him, I just have water in my hand and he has a sip, whether he wants or not. It brings fights. As you can imagine, he's pretty feisty, but he now just realized there's no way I'm going to get my whistle. I think the regular approach is better, but if you really didn't have time in a day, and sometimes this happens, then just get the water in when you can. You will you will probably have a bit of interrupted sleep, but it's still worse than not having the liquids in your body.
I was thinking we would perceive dehydration pretty quickly and efficiently as it's hydrocritical. Is that not the case?
I am not sure about that. Hilary?
I think I do, and I certainly don't drink a litre and a half.
I think very old people absolutely do not know when they're dehydrated. I've been a carer for 2 years, and it's something that needs watching.
Yeah.
You kind of lose the ability to sense that for yourself. It's very weird.
Yeah. Yeah. I would very much, thank you, Hilary, I would very much agree with that. I'm not being rude, I'm just being mindful of the time, because last time I overran about more than 20 minutes and everybody was still happily here, but I know that you have very busy lives as well. But yes, most people I know, probably nearly everyone, are dehydrated. And that's what it is. And it's also because we spend a lot of our lives in overheated, air-conditioned places. Just being here is dehydrating. So no matter how mean the weather feels today, it's much healthier out there for us. Because we may not be drinking, but at least we're not losing that much. And one thing is, we sometimes are aware that we might be sweating. When we are physically exercising a lot, you feel the sweat running. Sometimes you don't feel how much you're sweating. Sometimes we drive in the car, and when you get out of the car after 2 hours drive, you realize your back is completely wet. That can be half a liter, easily. We just don't realize how much we're sweating and losing and getting dehydrated. So bringing it back in is crucial, and it's crucial for mental well-being, physical well-being. It's crucial for everything, because being dehydrated can mimic early onset of dementia symptoms. It can get us to the brink of depression, and you know how things are. Our GPs do not know everything about us, so they will not tell us when we present with depression symptoms. They will not tell us, oh, come on, you must be dehydrated. There must be something else, because I know you, I've known your family. Let's take the medication here, leave it on standby if you really need it, but let's get you hydrated. Let's make sure you have all the nutrients and hydration you need, and let's exercise a bit, and let's see where you are. If you still need the medication, it's here for you. But our GPs can't do that. They have many patients. They have 5 to 10 minutes for each one of them. There's just no way somebody can know this about us. But knowing that being dehydrated can mimic early onset of dementia, it can mimic memory loss, it brings confusedness, it brings dizziness, it can get us to the brink of dementia if we are tired, and autumn is not an easy time in the year, let's face it. And sometimes we're tired, we haven't slept well for several nights for several reasons. We all get stressed and anxious about the health of our families, our children, our parents, our friends. Let's always start with hydrating, eating regularly, and moving outdoors, because whatever cannot be sorted by that, this is what the medication should be for. But that's not what we usually get. We usually get the medication first without really needing it. But the medication has side effects. And the less we drink, the more side effects it has. I'm sorry, I'll just be bashing your heads with the hydration. So, here goes. So, I have already mentioned that the brain is capable of producing some new brain cells at that later age. And the significant memory loss is not an inevitable result of aging, but it is just as with the muscle strength. So you have to use it, otherwise it's going to go. Our brain is perceiving so much information every day. Some of it gets cognitively processed, some of it doesn't, but it's still there. So whatever we want, there is only a certain amount of space that we can cognitively process every day. So whatever we're not using, the brain is just cutting it off to make space for new things that we may need to learn to increase our survival chances. So it is a natural capacity, well, capacity of the brain, that the brain will be losing whatever we're not using. So it is up to us to figure out what is it we absolutely want to hang on tightly and we don't want to lose, but then we need to work on it. I've mentioned lifestyle more times than you can probably digest today, and there is still more to go. Right. Many mental abilities are largely unaffected by normal aging processes. So ability to do things we've always done and continue to do often, but it's, again, we continue to do often. So the brain, it still realizes, okay, this is still a useful function, we will preserve it, keep it in the preserved box. Wisdom and knowledge you've acquired from the life experience, and your innate common sense and ability to form reasonable arguments and judgments. Now, I will leave aside how much other people's arguments are reasonable. So for most people, occasional lapses in memory are absolutely a normal part and not a warning sign of a serious mental deterioration. And as I said, for as long as you can remember that you forgot something, even if you can't remember what it is you forgot, but it's okay. And it happens to everybody. I had my son quite late, and he's definitely not a sleeper. And I have never understood how bad a proper sleep deprivation is and what it can do to you. It is awful, and it's just, the older we get, the worse we respond to lack of sleep. Now, our sleep doesn't improve with aging, unfortunately. So we may find alternative ways around it, resting or having enough physical activity in the day, because if it makes you tired, the brain will switch off because you just need that rest. So increased physical activity can help you sleep. But then you will need to increasingly exercise more and more because there is habituation as well.
How do you feel about napping during the day?
Whatever works. Whatever works.
I
If
never sleep for more than about 3 or maybe 4 hours at
Yeah.
night.
Yeah.
But very often
Yeah.
Sandy will
yeah,
gone to bed when I wake up to go to bed.
yeah, yeah.
They always say an hour before midnight is better than an hour after, 2 hours afterwards or something.
I have heard that too, but it sometimes means that, and I am having very similar experiences now, that sometimes my son he wakes up around 5 o'clock, 5:30, and he is very active. So it means, wake up, mommy, open your eyes. And I wake up, which means by 8 o'clock, I'm dead. I put him to bed. I very often fall asleep with him, and I just continue sleeping. I wake up 1 o'clock in the morning, and up until 4, I'm on. If I need to wake up 5 or 4:30 to come early to Milton Keynes, because that's what I do to beat the traffic on the M1, I don't even bother sleeping anymore. But that's just sometimes how and then I go and exercise till I barely can walk, so that I'm sure that I'm going to sleep the next night. So I'm not saying this is an ideal scenario, but life is hardly ever ideal. So whatever works for you to get rest, and not just the sleep rest, but also a mental rest. It can be, you can just lie with eyes closed, with the window open. Windows open are a brilliant thing. Listening to the nature, to the birds. It just find the way, find it, whatever it is that makes you rest, mentally and physically. The sleep will help whenever you can have it, but you may not be always able to have as much sleep as you would like. So, but it's not an easy thing, because sleep deprivation triggers another hormonal chaining, and it's more the adrenaline or adrenaline one, and it gets us into more of a fighting positions, because with a lack of sleep, things look very different. So if we can't sleep, we need to find a way to get rest somehow.
The World Service, sort of 3 o'clock in the morning is pretty good that morning.
Good. I'm glad to hear that. I'm heading there. Right. So I think I've mentioned already how how quickly the neurons die is just too depressing. I don't want to go over this again. Hormones and proteins that protect and repair brain cells and stimulate the neural growth also decline with age. So it is more natural for our neurons to shrink. So if we want them to flourish, we really need to be making efforts. Lack of exercise, physical activity, panacea for everything. Lack of exercise means that there is decreased blood flow to the brain. And what we need to know is that non-stimulated neurons or not connected neurons die faster. They go fast. So the more the neurons are interconnected, the slower they will die.
Sorry, can I just, with exercise, I mean, I do half an hour, 35 minutes on my exercise bike because of my knee. But that's one, half an hour in the morning. And then perhaps the rest of the day is just moving around the house and possibly doing bits and pieces. So, I mean, is that, going back similar to what you were saying about drinking water and so on, is that okay to have a mad half an hour and then take it easy during the rest of the day, or spread over? That's really what I'm trying to answer.
It is, and the answer will be very similar, Alan. It is, for as long as there is at least this half an hour, it's brilliant. If there can be more, because your body gets habituated to it. So if you do half an hour every day, after 3 or 4 months, you'll be like doing half an hour, barely sweating. I've done my half an hour, I'm gonna go now. It's a brilliant news because you got fitter, but you can challenge yourself perhaps a bit more. So either at 10 minutes here, not on every morning, but you can start adding 5 to 10 minutes of really speeding up a bit every 2 or 3 days to just challenge the cardiovascular system. It's good to go for a walk and breathe the fresh air and not getting breathless, but it's also good to go out, get breathless and sweating. So I'll let you do the maths. Dehydration, I will repeat it again. Sorry, you will just hate this word, but it's a very important one. And it is important to do it while we're still well and while we still can, because it's always much better to keep something going rather than starting something from scratch. So the following types of memory lapses are normal among older adults and generally are not considered warning signs of dementia. Occasionally forgetting where we left things that we use regularly, glasses or keys, just happens to everyone. Forgetting names of acquaintances or blocking your memory with similar one, or calling your grandson by your son's name. I can't remember how many times my mother has called me by my real name. There was always another one, most often my grandmother's one. It just happens throughout the life. Some people are more prone to this, some more people are more prone to something else. It's just we're all different. Occasionally forgetting an appointment or walking into a room, not remembering what we wanted when we entered. Now, what do you do? What do you do when this happens to you? Fantastic. It works. It works. It's unbelievable. I have no idea how is it possible that this works, but it just works. It's brilliant. It makes you walk as well. That's good. And that's even better. Becoming easily distracted, having trouble remembering what we've just read or the details of a conversation. So it's not just memory, it's the attention span as well. More we get into the memory, more it's taking us through a back road to attention span. Not quite being able to retrieve information we have on the tip of the tongue. That's just happens all the time. And it's also, our lives are busy. When we get stressed, there are so many things we have juggling, so many balls we have in the air, that we just need to be catching them all the time, remembering everything is for as long as you know where you can find it, downstairs, it's good.
Post-it notes are very helpful.
That's true, but that doesn't make you walk. Right, so normal age-related memory changes are on the left. So we're able to function independently, pursue normal activities. When the difficulty of performing simple tasks like paying bills or washing up or dressing, forgetting how to do things we've done many times, this is where we may become a bit worried. Able to recall and describe incidents of forgetfulness, that's fine. For as long as you remember that you forgot something, it's okay. Unable to recall that we forgot something is not an amazing sign. Pausing to remember directions, but not getting lost in familiar places, it's absolutely fine. Getting lost or disoriented in familiar places that we've known for many years, that we were able to walk around ourselves on our own, is a bit worrying. Occasional difficulty finding the right word, but having no trouble holding a conversation is absolutely fine, but words that get frequently forgotten or misused or garbled or repeating phrases, the same phrases in different conversations that may not be relating or connected, might be a sign of a mild cognitive impairment. Judgment and decision-making ability, if they stay more or less the same as always, that's fine. But when we get to a point where we have really a difficulty of making a choice, where we can't say whether we want this or whether we want that, or showing poor judgment, might be a mild cognitive impairment sign or an early onset dementia sign. The primary difference, though, between age-related memory loss and dementia is that the former, the first, isn't disabling. So for as long as it doesn't really disable us in our lives, it's most probably fine. And as I said, let's try first hydration, regular nutrition, and regular walks in the park, and then let's see whether things get a bit better, because it is very possible they will. When memory loss becomes so pervasive and severe that it disrupts our work, hobbies, social activities, family relationships, we may be experiencing the warning signs of Alzheimer's or another disorder that causes dementia or a condition that mimics the dementia. I've already mentioned that this severe dehydration can mimic early onset dementia symptoms. Sandy?
What's the difference between Alzheimer's and dementia?
They're both forms of dementia. They're both neurodegenerative
Is one worse than the
diseases.
other? Is Alzheimer's
No.
worse than dementia?
No. It is a type. Yeah, it is a type of dementia.
Because we've got a friend who is just gone out of it completely. And it's so sad. He was
It is.
such an active man. He's walked from
Yeah.
Land's End to John O'Groats or John O'Groats to Land's End. And he's
Go 35-mile walk around Milton Keynes. Wow.
yeah.
Because he wanted me to join him. I said, you've got to be kidding. But no, it's sad.
But
Yeah.
he's just
Yeah.
gone.
And it is. Thank you for sharing this. It is a very interesting thing you've just said, because we might be also thinking, but hang on, you're telling us how physical exercise is important, and this man's been walking and exercising, doing everything. He shouldn't have had dementia at all. If he hasn't been exercising, he might have had dementia much earlier. Perhaps. There are things we will never know. We know so little still about genetics. We cannot predict anything. We can just hang on to the hope, an idea that the lifestyle choices will make it as good as we can possibly have it. But we're not able to predict anything else. Yeah, I'm sorry to hear that.
Are there tests for checking?
There are. This is a Alzheimer or mild cognitive impairment questionnaire. You probably did unconsciously. So the mild cognitive impairment is an intermediate stage between normal age-related cognitive changes and more serious symptoms that might indicate dementia, one of the forms of dementia. So it would be memory, language, thinking, and judgment that are greater than normal age-related changes. But the line, again, between the mild cognitive impairment and normal memory problems isn't always a clear one, actually. It usually never is. But whenever in doubt, it might be good. So this link takes you to an Alzheimer's questionnaire. There are many other websites, many other links. If you put dementia questionnaire in a Google Scholar or memory clinic, it will give you a memory clinic that's near you. Your GP can point you towards one. It's always worth going and having the test done if you're worried, because if there is nothing to worry about, it's a good news. If there is something to start worrying about, the sooner you know, the better. Because the sooner you will know that, okay, now I have to do everything to keep losing it as slowly as I possibly can. So, although it is not, none of these findings are ever good ones. So it is good to go to the GP whenever in doubt. The early diagnosis can help us treat reversible causes of memory loss. So when we feel we have a severe memory problem, it may not even be dementia, it may be really relating to something else. And I will go through the list of things that are often relating to worsening or impaired memory, especially with older age. It's not that this happens only in older age or after we're 65 or 70. It's just that it's more visible, more prominently demonstrated at this age, also because of the wear and tear of all the other systems. It happens throughout the lifespan. Right, so reversible causes of memory loss. One of them is depression. Depression can mimic the signs of memory loss. It can make it hard for us to concentrate, stay organized, want to do anything. And if we're not motivated to do anything, if we can't see a reason to get out of the bed, we're hardly going to go and walk in the park. However, if our friends can take us, after half an hour, we will come back less depressed. We may still get back depressed, but it's not going to be as bad as it was when or before we went out. So physical activity is a huge yes for depression. The problem is how we get people who feel depressed to do it, because there is not motivation to do anything, and that's really tough. So this is where families, friends, colleagues would hopefully come in and just drag us out, say, okay, you don't want to go, I hear you, you're coming. Depression is a common problem in older adults, especially when people have a neurocognitive impairment or a form of dementia. Then it gets even more. But it's not only relating to neurodegenerative conditions, it can relate to life events. We can get depressed after an injury, after hospitalization, after having surgery under general anesthesia. Gosh, they give us so much drugs, then your system is completely out of it. So some of it may need patience, hydration. Whatever is not neurodegenerative, hydration will help with. If it's medically induced, if it's because of the drugs that we got for the general anesthesia or the drugs we got just after for pain, after the surgery, or if it's a trauma, it is a shock for our body, for our system, for our mind, for our muscles. It's an overall shock. Hydration will keep our metabolism working and getting rid of all the metabolites and toxins and everything that may otherwise accumulate in our body little by little by little by little by little, until we get to the stage where our body can cope. So whatever happens, keep drinking. Yeah, vitamin B deficiency. Vitamin B is very important. It protects our neurons, is vital to healthy brain functioning. And severe lack of B12 can cause permanent damage to the brain. Older people have a slower nutrition absorption rate, which can make it difficult for us to get the B12 that our body and mind need. Sometimes there is a similar problem with vitamin D that we talked often about, where if we have osteoporosis and bone thinning, we should be taking vitamin D. The trouble is that vitamin D tablets are not really gonna do it for us, because we need the active form of the vitamin D that gets created when we get the radiation on our receptors, and this is how the active form of vitamin D is created that gets to the bone, that has a binding properties for the calcium that then binds in the bones. Whenever we don't have that, whatever we take goes in, goes out, without really getting where it needs to be. So it's not just vitamin D, it's not just one or the other thing. It needs to be, if we need a vitamin D, we need to find a way to get it in the active form. And again, going outside, even on a cloudy day, there's still some radiation. Letting our skin out a bit, we might be freezing a little, but it's still worth it, because it will stimulate the right form of vitamin D to get and bind whatever calcium we have in our bones to keep them strong. This brings another slight trouble, is because with age, we're losing the number of receptors under the skin. So ideally, we would be going shorter sleeves and shorts. But yeah, if we are smokers, or if we drink, we may be at a particular risk. Smoking or drinking, I mentioned them later on as well, and I'll get back to them, can be quite tricky when aging. Smoking is problematic because with age, and I'll be talking about this in the next talk that will be around nutrition, the receptors are decreasing. They're decreasing in the skin, they're decreasing in our sensory systems, they're also decreasing for the taste. So the taste buds are decreasing in number. So things we remember as being amazingly tasty are suddenly not so tasty anymore. So we may not be keen, as we grow older, we may not be keen to eat because the food doesn't taste perhaps so well anymore. But we still need to eat, because if we don't eat, then we get malnourished and undernourished. It further makes our bones fragile, makes us weaker, wobblier, we will go less out and exercise. So it just induces all myriads of problems. Alcohol is problematic because it will secretly dehydrate us. If we overdo it to the bad hangover stage in the morning, it will kill many more than just 85,000 neurons in a day. So we just need to be mindful of that. Although an occasional glass of alcohol is not something that is very bad. Many people will be saying no, alcohol is the best dosage of alcohol. Well, yes, but then on the other hand, if you drink 2.5 liters water a day and you have a glass of wine, so again, it is about proportions. So if on one day or occasionally you just have more glasses, just have more water as well, to mitigate at least a little bit. Alcohol is problematic when we are taking medications, because some medications I've mentioned that kidneys and liver slow down with increasing age. It means that if there is some toxicity after drinking alcohol, it will stay for longer in the body. So it's not just what the alcohol does, but it's how the body reacts to the alcohol, what it produces, the metabolites. It will just stay longer. So this is a potential harm. If we're taking medication and some of these toxins meet with other toxins from the drugs, and then we need to bring in other toxins from drugs because we just need to be keeping the medication this way, then there might be an overload for kidneys, for liver. So the hydration is, again, crucial. Sorry, guys. Thyroid problems. The thyroid gland controls metabolism. So if metabolism is too fast, we may feel confused because whatever we eat just gets used so quickly that we just want to eat more and more and more. If our metabolism is too slow, we may feel sluggish, depressed even, and it may be even a clinical depression that might be induced by low function of the thyroid. So thyroid checking is a very, very important thing. And thyroid problems can cause memory problems such as forgetfulness, difficulty concentrating, and it's just appropriate medication can reverse the symptoms. Now, I haven't been talking very much about hormones and hormonal chaining. I've mentioned it every now and then. Because secretion of one dosage of a particular hormone will then induce another secretion of a particular dosage of another hormone. Then, and on and on and on we go into the chain. If the dosage, let's say, is decreased by the thyroid at some point in the chain, change the dosage of one hormone may change a dosage of another hormone. This may change a dosage of another hormone, and on and on and on and on. And hormonal secretion, what hormones we have in the bloodstream at a given period of time, it's nearly impossible to control, change. It's just incredibly difficult. One thing that helps apart from drinking, is exercise, because the exercise works as a bit of a shock to the body. So the body just needs to get back to some homeostasis. Now, where we want to have this homeostasis is also part of our lifestyle choices. If we don't exercise and we're happy with having sedentary life, whenever something happens, the homeostasis of our organism, this is where it's where the organism gets back home after trauma or an injury. This is where the organism will get. If you know you're having a surgery that awaits you and you will need all your strength to recover, do exercise well before you go. And I don't mean a week before. Have a plan. You may know 6, 7, 8 months the surgery is coming. Have a plan, exercise, because the better you are physically, the better you will be mentally as well before the procedure. And then this is going to be the home your body will be trying to get back to. So you will already prompt the body, you will prepare the body to get a better recovery than if we're coming back to exhausting state where the body is not sure where it is. Alcohol use abuse, I've mentioned that already. Dehydration, I've mentioned that already. Side effects of medication, I've mentioned that already. And it's time to exercise a little bit, to stretch a little. We have 8 more minutes. Absolutely.
Ventilation is coming through, and I'm freezing cold sitting here. Can I move?
Of course, please, move wherever you would like. Now, now, if I can ask you to stand up, we will do a bit of more gentle stretches again. Now, if you come back to where you're pushing against from the floor and you are slightly rethinking where you are, where your hips are, and where your shoulders are, whether your shoulders are in front of your hips, or whether you're actually putting shoulders behind your hips, or whether you have shoulders at just above your hips, you're still pushing away from the ground, and you would ideally feel that your abdominal muscles start taking part, because when you lean back, this is what keeps you stabilized. And if you keep breathing regularly, we can try a very gentle exercise. Just turn your head to the right, to the left. keep pushing away from the ground. There are many things to do at the same time. This is why this exercise is kind of demanding. Keep thinking about pushing away from the ground, breathing regularly. Now, you might be feeling that something, increased pressure, is happening in your abdomen, around your tummy, around your stomach, around your diaphragm. If you try to raise your hands, you're still pushing against from the ground, still pushing against from the ground. You keep your shoulders back, you keep your tummy engaged, your abdominal muscles engaged in the maintenance of the stance, and you take your hands from front to back. You should be feeling the and back, and you go up and down with your hands, with your arms, and breathing regularly. You should feel that there is an increased pressure in your abdomen, in your tummy. Now, this would be most probably because your diaphragm is working hard, engaging hard, to stabilize your body in the space so that you can move your hands and your body stays strong and stable. Now, you can stop moving your hands, but please keep breathing. We can sit down and we can continue breathing regularly and pushing away from the chair as well as from the floor. Well, I'll tell you a little bit more about the diaphragm function. The diaphragm is very important. We may or may not be able to, we're still raising up nicely, pushing away from the ground. The diaphragm is very important because it is a stabilizing element in our bodies. We don't realize this often, but whenever we want to turn our head or move our hands, the diaphragm needs to make sure that this part of body is stable so that other part of body can perform a movement. Now, we use diaphragm mostly for exhaling. When we breathe in, we exhale. This is where especially when we force the expiration, this is where we use diaphragm a lot. Ideally, we would be using diaphragm with breathing in as well, because the diaphragm will then work as a piston that with breathing in will just go low and create an increased intra-abdominal pressure. Now, increased intra-abdominal pressure is very healthy and good for us. It's good for our spine because it helps us straighten the spine. Are we still pushing away from the floor and from the chairs? I'm horrible, I know. It's going to be the end soon. Bear with me for a few more moments. So the diaphragm then creates kind of like a hovercraft, like an inflatable pillow that's inside our tummy that helps us to keep the spine straight. Now, our spine straight is a very good thing. Our diaphragm working while we're breathing in and while we're breathing out strengthens immensely the core. It uses all the core muscles that we should be using and that we're very often not using, especially when we just give in to the gravity. Feel free to do that because the difference is really striking. When we use the diaphragm, though, we're creating a good environment. We're creating a strong abdominal wall that helps the spine to carry the upper body. And that's quite a weight. So whenever we just give in, the spine has to take it all. And no wonder we have back pain in several places. So one way to prevent or reduce the back pain is to find a way back to use the diaphragm, which we all used when we were babies, because if we were not using diaphragm to stabilize the core of the body while lying on the back with our feet in the air, we would never turn our head. If we were not to turn the head, we would not be turning around. If we were not to turn around, we would not get crawling. If we were not crawling, we would not get onto feet. So this is something that we have. We just forget how to use it. Right, there are a few more points that I will skim through quickly. After that, please don't forget to breathe. I just wish we could have, when the weather's nice, we could perhaps have a talk in the park. It'd be nice to breathe fresh air. Right, so the same practices that contribute to healthy aging and physical vitality also contribute to healthy memory. So by taking steps early, we prevent the cognitive decline and we're preserving whatever it is we don't want to lose, and we have more of a chance to have not just longer life, but a better life, because we just can enjoy it more. Staying social, incredibly important. That people who are not very socially engaged with family and friends are at higher risk of memory problems. And it's not just the memory problems, but the memory problems is kind of a corollary of the non-stimulation, non-engagement. So not going into the filing system, remembering that, oh, this is the neighbor whose son does this and whose they always make me angry because they talk about this. It doesn't matter whether you agree or not. It's just the engagement, the stimulation should not be lost, because it will preserve the way to your beautiful, full filing cabinets. Face-to-face social interaction is fantastic. You know that when it's brilliant when things are difficult and you talk to people over the phone. It helps, because we're not made to live our lives in an isolated way. But when you can see people and feel people face to face, the stimulation is just 100,000 times more. It's just so much more. Right. Exercising regularly. I think I prompted you enough about that today. Smoking, non-smoking, managing stress. With stress, there is a very similar response to when we're not sleeping. It's the cortisol stress hormone that damages the brain over the time and can lead to memory problems as well. So if we cannot sleep, we may need to ask a GP or somebody what is there to help us sleep. And it may not be just medication. Try exercise, try hydration, try whatever you can before we touch the medication. But if nothing helps, taking some help to sleep every now and then might be the lesser evil, because not sleeping is just awful. Right. Sleep. Eating plenty fruits and vegetables, drinking green tea, having antioxidants. Apparently they're also in red wine. Don't forget about the proportions. 10 cups of clear water, cup of wine. I will be focusing on nutrition next time, so I'm not going to spend much time on it today. 5 pillars of aging well. Now, I've said many times, use it or lose it. Playing games you are familiar with or you're not familiar with. Play games with new people. Play games, engage. Challenge yourselves, don't make your lives mentally or physically too easy. As we're talking about hard workout or physical exercise, we're also talking about mental sweat or heavy lifting. Read and engage with whatever you like. You need to like it. You need to like what you do, because you need to want to go back and do it again. So whatever it is that makes you feel good, makes you rest, makes you engage with things, do it. Sometimes I have found that some part of my life that instead of, because I've been exercising all my life, so exercise would be everything. If I couldn't exercise, I would need to find another way to cope with stress. It's just, we need to find the way we can cope with things around us and life, because life throws things all the time. And at some point I found doing pottery, painting on glass, doing things with hands is very rewarding in many ways. We see immediately. Yeah, it is incredibly, isn't it? It is, because also you are doing something, so your part of your brain is focused there, but there is another part of your brain that processes things that you either didn't want to go back to, or it just an hour of painting or knitting or handwork can give your brain an immense rest that perhaps exercise or jog in the park or walk in the park could provide. And if you can't go out, this might be a way to get your brain a break, because the brain processes things, gets a perspective to things, and then things that were that problematic become, okay, it's still a problem, but it's not so overwhelming. So whatever works, whatever works. Learning new things. Get in the habit of learning new things. It's very important, and it incredibly stimulates the neurons and is good for us. Keep or take on projects that involve design and planning. That might be fun, because it make you redo your garden, you do a garden shed, you have projects. Have projects, because projects will bring you problems. You will need to deal with problems. It's immensely brain stimulating. Good luck. New research indicates that walking 6 to 9 miles every week can prevent brain shrinkage and memory loss. It's not the first study that says that physical exercise have immense value for the neuronal brain stimulation and connectedness. Of course, some of it will work, some of it will work a bit less. We're all slightly different there. The highlighted one is now the Aging Well Public Talks repository on Figshare. You have all the links in your handouts. Through there, you can access the previous lecture, the previous talk, and when we get close to the next talk, I'll upload it again when we have videos that Alessandro is so kindly recording for us. Thank you so much, Alex. I will put them there as well. I didn't make more than about 17, 18 of them today. So if you came later, I might have run out. But if you leave your email address with me, I'm going to send you the PowerPoint presentation. So please do. Yes, everything. And this is a recently published article. It only has 1,000 words. It's not as onerous as all these talks you have to sit through with me. It doesn't make you exercise, although it's going to prompt you to get out, go for a walk, take a glass of water as you go, say hi to your neighbor, etc. It has 5 very short videos for 5 minutes each. It's just additional resource. If you have any comments, I'll be very glad to hear them, read them. Please let me know, even if it doesn't come today and you send me something later on. Penny, thank you so much for sending yours today. So please just do send it on. You have my email address, and stay in touch and have a beautiful Christmas, New Year, and I hope to see you in January. Thank you so much.